Hey everyone, Dr. Ryan Westbrook here. If you're dealing with neuropathy, tingling, numbness, or that burning sensation in your feet or hands, listen carefully, because I'm about to share something that changed my perspective on this condition entirely. Over the past 15 years, I've worked with hundreds of neuropathy patients, and you know what I discovered? Some of the worst offenders making their symptoms worse aren't medications or mysterious underlying diseases. They're everyday habits that people don't even realize are sabotaging their nerve health. And the really good news? Most of these are completely within your control. Today, I'm going to walk you through 7 surprising habits that are likely making your neuropathy worse right now. And more importantly, what you can actually do about them. Before we dive into these 7 habits, I want to be crystal clear about something. I'm not a substitute for your doctor. If you haven't been evaluated for neuropathy, you need to see a healthcare provider. Neuropathy can have serious underlying causes, and some of those need proper medical attention. That said, managing the daily habits that affect your nerve health is something we absolutely can talk about, and it's incredibly powerful. So let's get started. The first habit that's making your neuropathy worse is probably something you do every single day without thinking about it. I'm talking about poor posture and staying in static positions for too long. Here's what happens in your body. Your nerves run throughout your body, and they have specific pathways. When you sit hunched over your desk for 8 hours straight, you're compressing those nerve pathways. Your sciatic nerve gets pinched. The nerves in your wrists get compressed. The blood flow to these areas decreases. Your nerves aren't getting the oxygen and nutrients they desperately need. I had a patient named Marcus who came to me with terrible foot neuropathy symptoms. He was a software developer, sitting at his desk basically motionless for 10 hours a day. We made one simple change. He started standing for 15 minutes every hour. Within 3 weeks, his symptoms were noticeably better. His burning sensation decreased by about 40%. The problem wasn't something we added to his life. It was movement we added back into his life. The second habit is something that shocks most people when I mention it. We're talking about inflammatory foods and patterns. Most people don't connect their diet directly to nerve pain, but inflammation is absolutely central to neuropathy progression. When you eat processed foods, refined sugars, and trans fats regularly, you're literally feeding inflammation in your body. Your immune system responds by increasing inflammatory molecules. These molecules attack nerve tissue and interfere with nerve signaling. It's like trying to send an electrical signal through a corrupted wire. The signal gets garbled. I've seen patients reduce their neuropathy symptoms by 30 to 50% just by reducing inflammatory foods. That means cutting back on processed snacks, fried foods, sugary beverages, and excessive refined carbohydrates. Replace some of that with anti-inflammatory foods like fatty fish, leafy greens, berries, nuts, and olive oil. Your nerves will thank you. The third habit is dehydration. This one's so simple that people often miss it completely. Your nerves need proper hydration to function optimally. When you're chronically dehydrated, your body can't maintain proper electrolyte balance. Sodium, potassium, and magnesium are critical for nerve function. Without proper hydration, these electrolytes become imbalanced. Your nerves can't fire signals correctly. Most of my neuropathy patients aren't drinking nearly enough water. If you're not urinating regularly throughout the day, or if your urine is dark yellow instead of pale, you're not drinking enough. I typically recommend starting with half your body weight in ounces of water daily. If you weigh 160 pounds, that's 80 ounces of water. That's your baseline. More if you exercise or live in a hot climate. The fourth habit I want to talk about is high blood sugar and insulin resistance. Now, this doesn't just apply to diabetics. Many people have undiagnosed insulin resistance or prediabetes. High blood sugar damages nerves directly. This is one of the primary mechanisms of diabetic neuropathy. Even if you're not diabetic, if you're eating in a way that causes constant blood sugar spikes, you're damaging your nerves. The constant roller coaster of high blood sugar followed by crashes puts tremendous stress on your nervous system. Over time, this damages the small nerve fibers. The solution here is stabilizing your blood sugar. That means eating balanced meals with protein, healthy fats, and complex carbohydrates together. It means avoiding eating carbohydrates alone. It means being consistent with meal timing. When your blood sugar is stable, your nerves are under less stress. The fifth habit is something I see constantly in my practice. We're talking about sedentary behavior and lack of movement. Now, I mentioned posture earlier, but this is different. This is about the overall lack of physical activity. When you don't move your body regularly, your circulation suffers. Your muscles weaken. The sensory feedback from movement actually helps your nervous system function better. This is called proprioception, and it's critical for nerve health. Physical activity also reduces inflammation throughout your body. It improves insulin sensitivity. It promotes nerve growth. I'm not talking about becoming an athlete. I'm talking about moving your body regularly. That could be walking, swimming, yoga, tai chi, cycling, or any activity that gets you moving without pain. Start with 20 to 30 minutes most days of the week. Progressive, gentle movement is one of the most powerful interventions for neuropathy, and it costs nothing. The sixth habit is chronic stress without proper management. Your nervous system is intimately connected to your stress response. When you're chronically stressed, your body remains in a state of high alert. This triggers ongoing inflammation. Your stress hormones, cortisol and adrenaline, remain elevated. This creates an environment where nerves deteriorate faster. Chronic stress also disrupts sleep, which is when your body does most of its repair work. I had a patient named Jennifer who had significant neuropathy symptoms. She was in a high-stress job where she felt constantly anxious. We didn't change anything medical. We focused on stress management. She started meditating for 10 minutes daily. She started taking walks. She set better boundaries at work. Her symptoms improved dramatically. Stress management isn't luxury. It's foundational healthcare. Find something that works for you. Meditation, breathing exercises, yoga, time in nature, creative hobbies, whatever helps you feel calmer and more centered. The seventh and final habit is sleep deprivation and poor sleep quality. Your peripheral nerves undergo significant repair and regeneration during sleep. When you're not sleeping well, that repair process gets disrupted. Your body can't heal. Nerve damage accumulates. Sleep deprivation also worsens pain perception, so you actually feel your symptoms more intensely. Most adults need 7 to 9 hours of sleep. I know modern life makes that hard, but it's genuinely critical for nerve health. If you're getting 5 or 6 hours, you're working against yourself. Focus on sleep basics. Go to bed and wake up at consistent times. Keep your bedroom cool and dark. Avoid screens for 30 minutes before bed. Avoid caffeine after 2 p.m. If you're still struggling, talk to your doctor. But honestly, just getting consistent, adequate sleep will make a noticeable difference in your neuropathy symptoms within a few weeks. Now, here's what I want you to understand about all 7 of these habits. They're not separate issues. They're interconnected. Poor posture reduces movement, which increases inflammation, which worsens blood sugar control, which adds stress, which disrupts sleep. On the flip side, improving one habit often improves others. When you start moving more, your sleep improves. When your sleep improves, your stress decreases. When your stress decreases, you make better food choices. When you make better food choices, your blood sugar stabilizes. See how this works? You don't have to fix all 7 at once. Pick the one that feels most relevant to you. Start there. Make that change a habit over the next few weeks. Then add the next one. Let me give you a real example. I had a patient named Robert who came to me with severe neuropathy. He was in pain almost constantly. His life was being taken over by this condition. We identified all 7 of these habits were present in his life. We didn't try to change everything overnight. We started with the one that seemed most impactful for him, which was his sedentary lifestyle and constant sitting. He started walking 30 minutes every morning. That's it. That was month 1. In month 2, he added better hydration. In month 3, he started reducing processed foods. By month 6, he had addressed all 7 areas, and his neuropathy symptoms had improved by probably 80%. He's not pain-free, but he's living his life again. He can play with his grandkids, he can work, he can exercise. That's realistic improvement. The thing about neuropathy that many doctors don't emphasize enough is that you have agency here. You're not just a passive victim waiting for a pharmaceutical solution. Now medications have their place if your doctor prescribes them. But the lifestyle factors we've talked about today are within your control. You can start implementing these changes today. You don't need permission. You don't need special equipment. You just need to decide that you're going to address these habits. Let me also mention something important. If you're dealing with severe neuropathy symptoms, especially if they're getting worse rapidly, you need to see a doctor. Neuropathy can be a sign of diabetes, vitamin deficiencies, infections, or other conditions that need proper diagnosis and treatment. Don't try to lifestyle your way out of a serious underlying problem. Get evaluated. Then, work with your healthcare provider on both the medical side and the lifestyle side. If this video has been helpful, please like it and subscribe. If you have questions about neuropathy or other health topics you'd like me to cover, put them in the comments. Also, check out my other videos on nerve health and pain management. I've created a whole series of content on this topic that might help you even further. Thank you so much for watching, and I hope you start feeling better soon. Take care.